Thank you, Speaker. My question is to the Minister for Health. How will 60-day prescribing make medicines cheaper for Australians with ongoing health conditions? Why wasn't this policy previously introduced?
The call to the Minister for Health and Aged Care.
Well, thank you, Speaker. I thank the member for Parramatta for his question. An enormously talented new member of Parliament. We're very, very lucky indeed to have him as part of the Labor team. And I say he, along with all other members of the Labor team, the last election promised Australians cheaper medicines. And already in just 12 months, Mr Speaker, we have delivered 3 stages of cheaper medicines reform, including obviously the largest cut to the price of medicines in the 75-year history of the PBS on the 1st of January, a cut that has already delivered $120 million back into the pockets of hard-working Australians. But, Mr Speaker, we know there is more to do, which is why we've accepted the advice of the medicines experts who manage the PBS to allow doctors to issue 60-day prescriptions for ongoing health conditions at the same price as a 30-day script, halving the cost of some medicines for 6 million Australian patients and freeing up millions of GP consults. Now, Mr Speaker, 30-day scripts make a lot of sense for a one-off course medicine for a single episode of illness, but they make no sense whatsoever for ongoing chronic health conditions where patients are on the same medicine year in, year out, decade in, decade out, sometimes for the remainder of their life. And that is why countries that we would usually compare ourselves to, like the UK, Canada, New Zealand and so many more, have been allowing 60 or even 90-day prescriptions for a long period of time. And that's why, Mr Speaker, our policy is supported by pretty much every single patient group, every doctor group in the country. But, Mr Speaker, as the question says, this is not new advice. It was provided by the same experts to the former government 5 long years ago, and they shelved it. They backed the lobby group instead of millions of hard-working Australian patients, making those patients shell out hundreds of millions of dollars that they shouldn't have had to pay. And, Mr Speaker, it seems they haven't learned, because this week I read in the News Limited tabloids half-price medicines in jeopardy as Coalition refuses support, blocking yet another sensible cost-of-living measure that will help 6 million Australian patients with their hip pocket pressure and their health. Well, Mr Speaker, this might not come as a surprise, given the Leader of the Opposition's record as a health minister. Not only did he try to abolish bulk billing, he also tried to jack up the price of scripts by $5. So maybe it's not a surprise to those hard-working patients he never supported as health minister. Mr Speaker, though, it does show they've learned absolutely nothing from 9 years of cuts and neglect to Medicare.